Hello everyone and welcome to this video lecture on AI application in healthcare. In this session, we will explore how artificial intelligence is transforming the healthcare sector, both globally and in India. We will start with an introduction to AI in healthcare, look at real-world examples, discuss the role of generative AI, and touch on ethical considerations. Most importantly, we will emphasize that AI is here to assist doctors, not replace them. Let's dive in. Let's begin with a simple question. What is AI in healthcare? Artificial intelligence or AI refers to the use of machines to simulate human intelligence. In healthcare, this means using AI to help with tasks like diagnosing diseases, recommending treatments, and even managing patient care. However, it is important to remember that AI is not here to replace the doctors. Instead, it's a powerful tool designed to assist healthcare professionals, making their work more efficient and accurate. The purpose of this lecture is to give you an overview of how AI is being used in healthcare around the world and in India. We will also explore the role of generative AI, which is a newer and exciting area of AI, and discuss some ethical consideration. By the end of this session, you will have a clear understanding of how AI is shaping the future of healthcare while keeping the human touch at its core. Before we dive deeper, let's take a moment to understand what you will gain from this lecture. By the end of this session, you will first understand how AI is being applied in healthcare globally and in India. We will look at real world examples to see how AI is making a difference. Second, learn about the role of generative AI in healthcare. This is a newer area of AI that's creating exciting opportunities, and we will explore how it's being used today. Third, we will discuss the ethical considerations surrounding AI in healthcare. This is a critical topic because while AI has immense potential, it also comes with challenges that need to be addressed. Finally, and most importantly, you will see how AI is designed to assist doctors, not to replace them. This is a key message we will revisit throughout the lecture. With these objectives in mind, let's move forward and explore the fascinating world of AI in healthcare. Now, let's look at how AI is being used in healthcare around the world. AI is transforming the sector in many ways, and here are some key areas where it's making a big impact. The main key areas are diagnostics, drug discovery, personalized medicine, and remote monitoring. So let's talk about diagnostics. AI powered tools are helping doctors detect diseases like cancer and strokes more accurately and quickly. For example, AI can analyze medical images such as X rays or MRIs to identify abnormalities that might be missed by a human eye. Next comes the drug discovery. Developing new drugs is a long and expensive process. AI is speeding up this by analyzing vast amount of data to identify potential drug candidates. The next one is personalized medicine. AI helps tailor treatments to individual patients by analyzing their unique genetic and health data. This means treatments can be more effective and have fewer side effects. The fourth one is remote monitoring. With wearable devices and IoT technology, AI enables real time monitoring of patients, especially those with chronic conditions. This helps doctors intervene early if something goes wrong. Now, let's talk about IBM Watson Health.
Let's check the website of the same. So, one great example of AI in action, IBM Watson Health. IBM Watson Health is a great example of AI in action. Watson uses AI to assist in cancer diagnosis and treatment recommendation. It analyzes medical data and provide insights to help doctors make better decisions. You can learn more about Watson Health at their website. These global applications show how AI is revolutionizing healthcare, making it more efficient, accurate, and patient centered. Now, let's shift our focus to India and see how AI is being applied in the healthcare sector here. India is embracing AI in exciting ways, and there are several initiatives and startups leading the charge. First, that we are going to talk about is Niti Aayog's AI healthcare strategy. The government, through Niti Aayog, has actively promoting the use of AI in healthcare. The focus is on using AI for early diagnosis and screening, especially in rural areas where access to healthcare is limited. Now let us look at the Niti Aayog's document that was released in June 2018. If we move to page 24, it talks about healthcare, where AI intervention is the main focus. So, as you can see, it talks about the shortage of doctors, nurses, and hospital beds. Doctor to patient ratio stands at 0.76 doctors per 1,000 people, well below the WHO recommendation of 1 doctor per 1,000. Additionally, nearly 70% of healthcare expenses are borne by individuals, making affordability a significant issue. We also see glaring disparities between rural and urban healthcare services. While larger hospitals and specialists are concentrated in major cities, rural populations struggle with limited access to basic healthcare. Now, if we move to page 28, we can see that it talks about cancer screening and pathology analysis. Every year, India registers over 1 million new cancer cases, yet there are only around 2,000 trained oncopathologists. To address this, Niti Aayog is working on AI-powered cancer detection by developing a national repository of annotated pathology images and an imaging biobank for cancer. This will help to create better AI models for early and accurate diagnosis, particularly in regions lacking trained specialists. Again, in the last part of the page 29, you can see that it again talks about another AI-driven initiative that focuses on early detection of diabetic retinopathy. This is being promoted by Niti Aayog in collaboration with Microsoft and Forus Health. The Trinetra device, equipped with AI-powered retinal imaging, is used to screen eye diseases even in remote areas without internet access. This initiative enhances preventive healthcare, reducing the risk of blindness among millions of diabetic patients. Now let's talk about the next, that is about startup. India is home to several innovative startups that are leveraging AI to solve healthcare challenges. For example, let's talk about Niramai. Niramai stands for non-invasive risk assessment with machine intelligence, is a Bengaluru-based health tech startup founded by Dr. Geeta Manjunath. The company has developed an innovative method for early-stage breast cancer detection using a technology called phytometrics. This approach combines thermal imaging with artificial intelligence to identify cancerous tissue without the need of radiation or invasive procedures. Traditional mammography can be uncomfortable and is less effective for women under 45 due to denser breast tissue. Niramai's Theramelatics technology addresses this by using a high-resolution thermal-sensitive device to capture images, which are then analyzed by AI algorithm to detect abnormalities. This method is not only non-invasive and painless but also more accessible, especially in rural areas where advanced medicine facilities are limited. Now, let's again talk about another startup that Cure.ai. Cure.ai is another pioneering Indian company leveraging artificial intelligence to revolutionize healthcare. Specializing in medical imaging, Cure AI has developed AI-powered tools that assist in quick and accurate interpretation of radiology images, including X-rays and CT scan. These solutions aim to enhance diagnostic effectively and support clinicians in making informative decisions. During COVID-19 pandemic, Your AI's SIS X-ray analysis tool QXR played a crucial role in identifying lung infection associated with the virus. By rapidly analyzing X-rays, QXR helped in triggering patients based on severity of their condition, thereby optimizing the allocation of medical resources. Both Niramai and Cure.ai exemplify how artificial intelligence is transforming healthcare in India by developing innovative solutions tailored to address specific medical challenges. These companies are not only improving diagnostic accuracy and efficiency but also making quality healthcare more accessible to diverse populations. Now, let's talk about generative AI in healthcare. This technology is opening up innovative ways to improve patient care and enhance communication. Here are some key ways generative AI is being used in healthcare. Let us discuss it now. The first one is medical documentation. Doctors and healthcare professionals often spend a significant amount of time writing patient notes, research summaries, or medical reports. Generative AI tools like ChatGPT can automate this process. For example, doctor can detect their notes and the AI can generate a well-structured summary, saving time and reducing administrative burden. Let us understand this with a simple prompt like this, where I write a patient is a 45-year-old male with history of hypertension, complaints of chest pain and dizziness, prescribe beta blockers and advise lifestyle changes. Let's see how it prepares a note. Okay. Secondly, we are now going to talk about patient communication. Generative AI can help create personalized communication for patients. For instance, it can generate easy way to understand explanation of medical conditions, treatment plans, or post-operative care instructions. This ensures patients are well informed and engaged in their care. Suppose a patient has a diabetes and the doctor wants to explain about his condition. Just try a prompt that explain diabetes in simple terms for a patient. So it will create a beautiful note explaining everything to the patient. The third thing that we are going to talk about is medical training and simulation. Generative AI can create realistic medical scenarios for training healthcare professionals. For example, it can generate synthetic patient case with detailed symptoms, lab results, and imaging data. This allows medical students and doctors to practice diagnosis and treating conditions in safe and forceful environment. Let us see how we can generate a fictional patient case for medical training exercise. Let's try this prompt. Read it out and check what is the output. The fourth thing we are going to talk about is personalized health content. Generative AI can create tailored health and wellness content for patients. For example, it can generate diet plans, exercise routine, or mental health tips based on individuals' medical history preferences. In relation to this, we can add a simple prompt, create a 7-day diet plan for a diabetic patient, and it will beautifully give us an output for each day. As you can see, generative AI is still evolving, but its potential to transform healthcare workflows, improve patient engagement, and support medical professionals is immense. It's a tool that complements human expertise, making healthcare more efficient and patient-centered.
While AI has incredible potential in healthcare, it also comes with important ethical consideration that we must address. Let's discuss some of the key issues. The first one is bias in AI algorithm. AI systems are only as good as the data they are trained on. If the data is biased, the AI decisions can be unfair and inaccurate. Data privacy. AI systems often rely on large amount of patients' data. Protecting this data and ensuring patients' privacy is critical. Unauthorized access or misuse of data can have serious consequences. Accountability. If an AI system makes a mistake, who is responsible? Is it the developer, the healthcare provider, or the institution using the AI? Clear guidelines are needed to address this. Human oversight. AI should never replace doctors. Instead, it should assist them. Human judgment and empathy are irreplaceable. In healthcare, an AI should always be used as a tool to support, not to replace the healthcare professionals. Transparency is a key. Patients and doctors need to understand how AI systems work and how decisions are made. This builds trust and ensures the AI is used responsibly. As we continue to adopt AI in healthcare, addressing these ethical challenges will be crucial to ensure that AI benefits everyone fairly and safely. Let's take a moment to summarize what we have covered in this lecture. Here are the key takeaways. AI is transforming healthcare globally and in India. From diagnostics and professionalized medicine to remote monitoring, AI is making healthcare more efficient, accurate, and accessible. India is embracing AI in healthcare. Initiatives like Niti Aayog's AI strategy and startups like Niramoy and Cure.ai are leading the way in using AI to solve healthcare challenges, especially in diagnostics and early disease detection. Generative AI is playing a growing role. Tools like ChatGPT are helping with medical documentation, patient communication, medical training, and personalized health content. These applications are streamlining workflow and improving patients' engagement. Ethical considerations are critical. Issues like bias, data privacy, accountability, and the need of human oversight must be addressed to ensure AI is used responsibly and fairly. Most importantly, AI is here to assist, not replace doctors. Human judgment, empathy, and expertise remain the heart of the healthcare, and AI is a tool to enhance, not replace, these qualities. Thank you so much for joining me in this lecture on AI application in healthcare. I hope you find it informative and insightful. AI is undoubtedly transforming healthcare, but it is important to remember that it's a tool to assist, not replace the incredible work that doctors and the healthcare professionals do every day. Thank you once again. I wish you all the best in your journey to explore the fascinating world of AI in healthcare. Take care.